Now, an umbrella group of British charities is launching an appeal to try to help at least 16 million people in East Africa who are on the brink of starvation. The Disasters Emergency Committee says more than 800,000 children under the age of 5 will die soon if supplies do not reach them. People from Somalia, Kenya, Ethiopia and South Sudan urgently need food, water and medical treatment. Ongoing conflicts and drought are being blamed for this crisis. And with me now in the studio is Oenone Chadburn, who is the head of Humanitarian Support for Tearfund, which is one of the charities involved in this appeal. Thanks so much for coming into the studio. It has to be, we should explain for the international audience, it has to be quite a big deal and quite a big crisis for the Disasters Emergencies Committee to actually get involved and launch this sort of unified appeal, doesn't it?
Absolutely, absolutely. And so what we've seen is unprecedented indicators that we are facing famine in places like South Sudan. We know that places like Somalia, we expect the children to reach to be 1 million children severely malnourished by July if there is no significant intervention. So we need to be giving out some support with food aid, supplementary feeding, giving medical assistance and just providing access to clean water wherever we can.
I mean, those things are done regularly anyway by charities such as yourself, other organisations working across East Africa on a daily basis. But the need is now heightened and you need more of that. Is that what it is? I mean, you're already in those areas, aren't you?
Absolutely, absolutely. So Tearfund has been working in places like South Sudan and Ethiopia and Somalia for many, many years. And our work in Ethiopia last year alone, we were hearing stories of people saying, this is already life-saving intervention for us. And we were doing emergency food packages. We know of one story where a girl called Maddie, her father is sacrificing his food so she can still eat properly, so she can go to school. And that's quite significant when people are actually giving up, parents are actually giving up their food supply for their children. And what we know is that this particular family, they were displaced they had to leave their location because their crops had failed. They went with their livestock and they were in search of food and water and their livestock died. The mother died and now Maddie's sister is also sick. And the father said, without this life-saving intervention of food, the food packages, just the food supply that we could get from Tearfund, we would be in a very desperate situation.
This, of course, is just one appeal and it's centred on the UK, here in the UK. Internationally, appeals are being sent out and it's not just the public that are required to give to these charities. The big contributors really are the international community, aren't they? It is the countries who have to be pushed and pressured to actually give huge amounts of money.
Yeah, but DFID and the British government have given aid match to DC already and we're very grateful for that. They've given 5 million. So there are governments who are stepping up to the plate to actually do their work. But we know, the government of Ethiopia have worked with the UN to say we need just under $900 million to be able to support this critical time and this critical intervention. And it's those kind of figures that are quite exceptional, but any kind of funding that the combination of agencies, that the DC agencies get, will be used well and effectively to serve this need right now.
Is there a fear, as there always is when you have big campaigns like this, is there a fear that there is donor fatigue? I mean, the big crisis that has been for the last couple of years has been Syria, and there's been a huge amount of money raised to help Syrian refugees. When you get another disaster like this, is there that issue where people say, look, hang on a minute, we're already giving a certain amount of money to this and a certain amount of money to that. You're asking for more money now?
Do you know what? I'm always amazed at the generosity of the British public, very genuinely. I always think, gosh, are we really able to ask again, or can we ask for more? And already we know that certainly Tearfund phones this morning have been buzzing with extraordinary generosity, and that gives us enormous heart and a real sense of, well, OK, we need to be able to communicate this story. We need to be able to tell these people. I was in South Sudan not too long ago. And I met a little boy called Bangui. He was at one of Tearfund's feeding programmes. I had to walk, do a 9-hour trek. I had 4.5 hours to walk to the feeding centre and 4.5 hours back. And I was wading through swamps that came up to my waist at times. These are very difficult, hard to access areas. And this little boy, Bangui, he was suffering from bloody diarrhoea. He had a little Chelsea football shirt on and his mum brought him to the feeding centre and we were able to to provide what we would call an outpatient service. That means that people come to us regularly, and we were able to supply him with what we call, I call it glorified peanut butter. It's called plum peanut, and it's a special supplementary feeding nutritional paste. And we were encouraging his mother, giving his mother advice on how to care for him to make sure that he didn't get any worse and didn't suffer any more from the very being severely malnourished.
And stories like that just need to be replicated right across East Africa. Really good to have you in, and really good luck with the campaign. Thanks so much.
Thank you very much.